Of today's show is brought to you by Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. Well, Tuesdays are always a personal favorite of mine because we get to learn from the folks at Health Diagnostic Laboratories. We learn so much about our health and prevention especially. So Dr. Tara Dall is back with us now. Hello.
Hello.
So we're going to talk about diabetes, an epidemic in this country. The difference between type 1 and type 2 and how we can test at a very early age or at a very early time on whether this is going to be a problem for people.
Right. So this is a critical issue in society. I mean, it's even around the world. I mean, this is a pandemic, not just a United States phenomenon. So what we want to be able to do is diagnose diabetes, you know, as many years as we can before it's actually affected the pancreas to the extent that the pancreas stops working. Because once the pancreas stops working, it's much harder to reverse the disease. It'd be much better if we can sort of recognize someone's on that path and then do what we can to prevent it. And we do that with diet and exercise, and sometimes we use, you know, generic therapies that can help too. But it's critically important. So we have something called the Diabetes Prevention and Management Panel, which is a number of tests that can detect diabetes very, very, very early, really before you have it. And it's critically important.
Reversible?
It's absolutely still reversible. And that's what's powerful about it, because if you find out after the fact, you know, then it's less of an effective test. But we can really diagnose diabetes extremely early. In fact, I recently had my daughter screened. She's 9. She's perfect in every way. You know, she's thin and beautiful, and she actually has early markers of diabetes. And I personally have prediabetes myself. So
is this genetic?
It can be genetic. I mean, and you can. I've never been overweight. I mean, she's certainly not overweight. So there is this genetic predisposition, but certainly at her age, I know now I need to work on making sure she doesn't eat too much sugar in order to prevent, you know, diabetes from coming on. But I wouldn't have otherwise even thought about that.
It would be after the fact when she had symptoms,
or she gets into high school and now she's gaining a lot of weight, and you see a lot of kids that are affected by this. So our testing can detect early signs of disease. Also, we have an antibody called the anti-GAD antibody, which can help determine whether somebody has type 1 or type 2 diabetes, which is really interesting because some people with what's called type 2 diabetes are on a whole bunch of diabetes medications. But when they have this positive antibody, it means that this antibody is attacking the pancreas, and actually those people do much better if they get a little bit of insulin. And I'm technically, I don't like insulin. I do everything to keep people off insulin. But if that's part of what's going on where their pancreas has been destroyed, then really insulin is going to work a lot better for them
instead of the other medications.
Instead of the other medication, they're taking all these medications that aren't necessarily helping. There's also adults who sometimes have this later in life. Usually type 1 diabetes happens when you're a kid. And basically you get these antibodies. They're like little Pac-Mans that attack your pancreas and basically make the pancreas stop working. So your body can't make insulin. You just can't produce any insulin. That's why you need to take insulin. But we find now that actually there are adults who develop this later in life. And so we can get educated about that and learn that early on and really be able to treat people much more effectively.
Yeah, I feel like this is, you know, I always said when my kids were little, I wish they came with an instruction manual, you know, that just had, okay, do this and do this and do this. But I feel like that would be part of it, you know, take them in and get this panel done so actually you know the lessons that you really need to teach your child. Like you said with your daughter, you really need to be careful about how much sugar you give her so she doesn't have this, you know, addiction to sugar as she gets older. I just feel like it's so incredibly important, and as parents, we don't know.
Right. No, you really don't know. The current guidelines for cholesterol now say that we're supposed to screen kids between the ages of 9 and 11. So I figure if you're going to poke your kid with a needle, you might as well get a test that's, you know, more accurate at really telling the story of what's going on.
And more detailed. So, and really going to show you a lot more than the traditional
And you
test
don't need to do a 20-page panel. I mean, you can do a more abbreviated advanced panel in kids, but certainly to understand whether they truly have risk for heart disease or whether they just have high cholesterol because of their diet or they have issues related to insulin resistance because of their diet, and then we can begin to make changes early.
Yeah, and I'm a big fan of just knowing the state of my health no matter what. So I want to know if I have a predisposition for something. I want to know how I'm currently doing, you know, and then I would look at my diet, my lifestyle. And I feel like for me anyway, you know, every year to be able to do, you know, a complete panel and have see a timeline of my health, I just sort of feel like that's the way to go, and I hope that that's where healthcare is headed. I hope more people are going to do those. We've talked before about like the full body scans, things like that are so preventative.
Right.
Yeah.
Yeah, I mean, information is so empowering. I think there's people who are afraid. There's a lot of people who don't want to know. And I never really understood that. I'm thinking if you
it's
know,
scary.
you can do something about it, though. It's not
Especially
like
if you
it's
know
a
early
death
on,
sentence. Yeah,
right?
exactly.
You know early on,
Right.
then you know that in most circumstances, almost
Right.
all of them, you can at least get a head start on whatever therapy you need to
Right.
start to get well.
Right.
So anyway, always good stuff. Thanks for being here.
Thank you.
You can get more information about the Health Diagnostic Laboratory by going to their website. You'll find them at hdlabinc.com, or you can also give them a call at the numbers there on your screen. And remember, talk to your own doctor to request any of the HDL tests. And these folks will be here every Tuesday to talk about your health. We're back with more broadcast in just a moment.